Good afternoon, everyone. Welcome to the Opioids, Drug-Related Emergencies, and Substance Abuse Prevention Before, During, and After the COVID-19 Pandemic webinar. This webinar is being hosted by your presenters at the U.S. Department of Education's Office of Safe and Supportive Schools, OSSS, and its Readiness and Emergency Management for Schools Technical Assistance Center, the REMS-TA Center, or REMS for short. Before we get started, we wanted to share the following tips about interacting with this event. In the web links pod on your screen are relevant web pages. Select the name of the web page you would like to see and click the Browse To button. We encourage you to explore each of these pages, but you are also invited to share with others. The Q&A pod is the mode that you can use to communicate directly with us, your webinar presenters. If you experience any technical difficulties during the event, please use the Q&A pod to let us know. Available in the Files pod on your screen are relevant handouts that we've uploaded for you. Select the name of the handouts you would like to review and click the Download Files button. And as a reminder, there is no dial-in for this webinar. Audio is available via the link provided. If you are experiencing difficulty hearing the audio stream, please turn up your computer speaker volume at this time. Again, the Q&A pod is there for you to send a message to the facilitator. Please send us questions at any time during the webinar related to the presentation content or the REMS-TA Center in general, and we will answer them at the end of the event, as time permits following the presentation. After the live event, please send us questions to our help desk at info@remstacenter.org. This webinar is being recorded and will be made available in the archives form on our site within 7 business days of the live event. We will be hosting a Twitter chat on this topic directly following this webinar today. And now I'd like to start with introducing myself and my co-presenters today. Dr. Sakara Fisher received her doctoral training in school psychology at Michigan State University with an emphasis on working with culturally diverse populations. She served for 3 years as a school psychologist at an urban charter school in Washington, D.C. Dr. Fisher's research focuses on improving life outcomes for diverse populations. For her full bio, please see the Files pod. Elise Robertson serves as an education program specialist at the Office of Elementary and Secondary Education, Office of Safe and Supportive Schools at the U.S. Department of Education. Elise provides support and technical assistance to grantees and other stakeholders for several federal grant programs related to special populations in school climate, and she participates on many federal interagency working groups focused on preventing youth substance abuse. My name is Allison Curtis, and I am the Director of Information and Product Management at the REMS-TA Center. I've been with the TA Center since 2014, and I am involved in many school safety projects, including our EOP interactive tools, SiteAssess mobile application, resource collection, our toolbox, and our website. So let's take a look at the agenda for today's meeting. First, I will provide an introduction to opioids and their connection to school safety. Then Dr. Fisher will provide an overview of adolescent substance use and discuss school-based prevention and interventions. Next, I will explore planning for opioid overdoses and other drug-related emergencies. And then Elise will discuss resources to help prevent and reduce youth drug and substance use. And then we will end the event with a Q&A session. Before we dive into the presentation today, let's get started with a poll question that will help understand your role. Please select the role that's most applicable to you. Are you a school or school district administrator, staff at a school or school district, teacher, school psychologist, counselor, social worker, school nurse, school resource officer, or law enforcement professional, local mental health practitioner or local public health practitioner, state education agency or school safety center personnel, or maybe another role that's not identified up here. Thanks so much for providing that information. Everyone plays a critical role in school safety, and so we're so glad to have a diverse audience here today. Moving on to our next slide. We'd also like to hear a little bit about your interest on the topic today. So in this poll, please type in 1 to 2 words about why you're here today. Again, what's your interest on the topic and why are you here today? 1 to 2 words. Looking for prevention education, professional development, safety, resources. Experiencing severe drug problems at your school. Wow, some great answers. So glad you all joined us here today for all of these reasons. It's fantastic. We look forward to connecting you with resources, connecting you with safety strategies, and certainly prevention and intervention methods that are school-based. Thanks again for answering the poll. We will end the poll now and move on to the next slide. So let's get started by providing an introduction to opioids and discuss their connection to school safety. First, we want to make sure we all have a common understanding of what we mean when we are referring to opioid misuse or abuse. Prescription opioids can be misused or abused by an individual who takes another person's opioid prescription, even if it is to relieve their own pain. It can be misused or abused by an individual who takes an opioid medication in ways other than prescribed, such as taking it more often, taking more than the prescribed dose, snorting or injecting the drug, or mixing it with alcohol or other drugs not described as safe by a doctor or pharmacist, or the opioid prescription can be used to get high. So an opioid use disorder or addiction is less common with short-term medical use, but longer-term use can lead to opioid dependence, tolerance, and possibly addiction. One large dose of an opioid can slow or stop the breathing, leading to an overdose that can be fatal. Risks of overdose are increased when the opioid is taken with alcohol or sedatives. Schools may find the threat of opioid misuse and abuse affects their population in several possible ways. Students may use or abuse opioids themselves, leading to issues with drug dependence, addiction, and even the potential for overdose. Parents, guardians, family members, or roommates of students may be dealing with addiction issues at home, with members of their household using or abusing opioids themselves. And parents and guardians may be unaware that opioids they have in the home are being taken by their children. Teachers, faculty, and staff may have opioid use or abuse issues. Use by any member of the educational community might bring drugs physically to the campus grounds and in some cases lead to drug dealing on or around the property. And then corollary issues that result from drug use and abuse might affect school members or the community as a whole, such as increased property crimes, fighting, vandalism, and the presence of weapons, other drugs or alcohol, or discarded drug paraphernalia that affects the overall safety of the environment and students' sense of safety. When we think about emergencies that would be addressed within your school emergency operations plan, we are typically thinking about an emergency event, something that has a distinct before, during, and after phase. You can see examples of these on your screen: natural hazards such as flooding or wildfires, adversarial and human-caused threats such as gang violence or active shooter situations. So when we neatly try to apply that framework to the topic of opioid misuse or abuse, it doesn't always neatly align since the many ways that opioid abuse manifests in the school community, like we just discussed, aren't always distinct events. But because the issue of opioid use and abuse was declared a national public health emergency in 2017, and because it so broadly and deeply affects individuals and communities, it is an issue of concern to schools and can and should be addressed in a variety of ways. One way to consider opioid overdose a human-caused threat that is considered within a school emergency operations plan. Another is to consider addressing opioid misuse and abuse as part of a comprehensive alcohol and drug prevention and intervention program. And we will talk about both of these approaches in today's webinar. As you know, in addition to thinking about the before, during, and after phases of an emergency event, we also always consider how these three timeframes integrate with the 5 preparedness mission areas: prevention, protection, mitigation, response, and recovery. Within the context of school preparedness, prevention is defined as the actions schools take to stop an event from occurring. Here we mean preventing an opioid overdose event. In just a moment, you will be hearing Dr. Fisher share a great deal of important information about prevention in the field of alcohol and drug use, specifically evidence-based alcohol and drug prevention programs. Know that while these concepts are broadly the same, obviously both are focused on preventing opioid use and abuse, the evidence-based practices are tied to the field of alcohol and drug prevention specifically. So with that context, I'm now going to turn things over to Dr. Fisher to give us an in-depth look at adolescent substance abuse and several school-based prevention and intervention methods that can help schools address this issue. Dr. Fisher?
Thank you, Allison. Hello, everyone. I am happy to be able to present to you today. Adolescent substance use prevention and school-based preventive interventions are a passion of mine that emerged from my time working as a school psychologist providing mental health services, and is now my main area of research funded by the National Institute on Drug Abuse, now that I've transitioned to academia. I'm happy to share what I've learned with you all. Before getting into the prevention and intervention efforts, I wanted to give a picture of the landscape of adolescent drug use now. The data that I'm showing you was compiled by the National Institute on Drug Abuse from the 2019 Monitoring the Future data, which is an annual survey of a nationally representative group of students. This first slide shows you the trends in illicit drug use among 12th graders, with illicit drug use decreasing since 1997, but holding pretty steady since 2018. So we can see that marijuana is the leading illicit drug, with smaller numbers of LSD, synthetic cannabinoids, cocaine, MDMA, and then lastly, heroin. Looking more specifically at marijuana, you can see that daily marijuana use is actually trending up for 8th, 10th, and 12th graders, and that this gap is closing between 10th and 12th graders in past year marijuana use. Part of this increase may be due to legalization of marijuana for adults in many states, or the increase of the use of vape devices to vape marijuana, but this is unknown at this moment. Here we have the use of opioids, specifically Vicodin and OxyContin. Use really spiked in 2009, but it's decreased significantly since then, with just around 1% to 2% of youth reporting using these substances in 2019. Now, while these numbers are decreasing for adolescents, there is no doubt that when kids use these drugs, it has a devastating impact on them and their communities, including schools. Here we have some information on vaping, which I'm sure if you all are working in the schools directly with kids, or even if you aren't, you guys have definitely seen the increase in vaping. You can see that vaping is a significant concern, with 11.7% of youth reporting the vaping of nicotine. You can see that smoking combustible nicotine or cigarettes has continued to decline. So what you find is that you may ask students about their vaping habits, and they will admit to vaping nicotine, but if you ask them about a cigarette, they're absolutely like, oh, I would never do anything like that. And so vaping, unfortunately, has made nicotine more accessible to adolescents, whereas we were really making great strides with decreasing nicotine use among youth. While vape pods, unfortunately, they have the same amount of nicotine as 20 cigarettes, and with attractive flavors like green apple, it's definitely a public health concern for adolescents. Further, vaping marijuana, which wasn't measured in 2019, is what was actually related to the lung-related emergency room visits and deaths that you heard about in the news, with the additive of vitamin E acetate causing a lot of damage. So this is something that schools will really have to continue to monitor. Yes, definitely vaping cannabinoids as well. This is definitely a concern right now with an increase in use vaping marijuana. In addition to nicotine, most of the time if you talk to adolescents, you'll find that they're not just vaping one substance. And because smoking combustible marijuana often leads to a lot of odorous smells, the fact that you can vape marijuana and not have the same detection also leads to the increased desirability for adolescents. So it's definitely a concern. Now we're going to move on to alcohol use. Alcohol rates have continued their decline, but stay at a significantly high level to still warrant prevention and intervention efforts. And as you can see, binge drinking has also continued to decline. So there are a number of substances that kids are using in schools that I know all of you all are coming into contact with and have seen firsthand the devastating effects it can have on kids, families, and communities. But substance use doesn't just occur in a vacuum. It is often a symptom of some other underlying mental health concerns. There are a plethora of research connecting substance misuse with externalizing behaviors, such as conduct disorder and attention deficit hyperactivity disorder. This has been hypothesized to be related to an underlying genetic externalizing factor that contributes not only to these externalizing behaviors, but also to alcohol and drug dependence. So knowing this, think about the kids in your school who will be most at risk for developing a substance use disorder. Maybe the ones with an IEP for an emotional behavioral disorder, those kids who just can't stay in their seat and blurt out their answers. Those are the kids that may already have risk factors priming them for current or later drug abuse. While most of the research on comorbidity with substance use disorders focuses on externalizing behavior, research also suggests comorbidity with internalizing behaviors such as anxiety and depression. Again, other risk factors definitely for adolescent substance use to be on the lookout for. So what is the impact of COVID-19 on adolescent mental health and substance use? Now, the data is still being collected, and this has been really difficult to do because most universities had to shut down their IRBs and all that sort of thing in the past. And so data is being collected, and the results are just coming out. Initial results find that it does lead to increased reported levels of anxiety. The lack of peer contact due to physical social distancing has become an issue with socialization, reduced opportunities for stress regulation. And then you have the effect on the child that actually occurs through their immediate environment, like increased risk for parental mental illness and domestic violence and child maltreatment. Those most at risk are children and adolescents who need access to specialized services or have functional needs, have existing mental health problems, or trauma experiences. And we need to keep in mind that this pandemic in and of itself has likely contributed to some amount of additional trauma in students. Lastly, families with migrant backgrounds and low socioeconomic statuses are more likely to be impacted by the economic impact of COVID, which contributes to additional stress. So how are adolescent substance use and mental health issues related to outcomes that we're interested in? Well, it can lead to violent behavior, like Allison said earlier, criminal offenses, poor academic achievement, and a diagnosis of a substance use disorder as an adult. So what are some school-based prevention programs and interventions that we can use to address some of this substance use that we're seeing in schools. I will provide some evidence-based approaches and interventions within a multi-tiered system of support or response to intervention framework. So first tier, universal prevention, information that is provided to the entire student body to prevent the need for extensive intervention. There are 3 proven approaches to universal prevention. The first is social skills resistance training. So this is where students are taught to identify students or situations where they may be pressured into using drugs and taught ways to avoid or effectively deal with these situations. The second is normative education. This attempts to correct any inaccurate perceptions regarding the high prevalence of substance use. So if the students actually see the number of students using is lower than their perception, it can actually reduce the perceptions of social acceptability. You can do this using local or school data if you give a survey, or if your school participates in a survey yearly. Here in Georgia, it's the Georgia Student Health Survey, or you can use state or national data. So the data that I presented earlier through the National Institute on Drug Abuse, the Monitoring the Future, you could actually pull data from that. They also have data on attitudes towards drugs, acceptance of drug-using behavior, which may also be really helpful in providing some of this normative education. And then the third is competence enhancement skills training. This is providing students with the tools to problem solve and make decisions. It provides the skills for resisting peer or media influences, for increasing their self-control and self-esteem, and adapting some coping strategies for relieving stress and anxiety through cognitive coping skills or behavioral relaxation. I think one of the most profound things that I heard while I was doing interviews with substance-using teens for one of my research projects is one of the high school students saying that he felt that the schools cared more about his personal well-being and less about test scores and homework assignments and all of that. So really making sure that we're providing some ways and that we're letting students know that we have resources available to them to be able to help them deal with high school in particular. Can be very stressful for kids trying to get into colleges. So counteracting some of that pressure with some skills for coping and behavioral relaxation. And then lastly, it can teach social skills and assertive skills. Later on in the presentation, I will present a few model programs that encompass all of these approaches. Tier 2 and Tier 3, you can use a multitude of approaches. First, I want to bring up this SBIRT process, which is screening, brief intervention, and referral to treatment. While SBIRT is not an intervention, it is an approach to providing interventions. I really feel it's a great fit for schools who already engage in some sort of multi-tiered systems of support. So the screening in this case would be a screening for substance abuse risk. There are a number of screeners available that can be used for screening students for substance use risk. If a student is identified on the screener as having to be at risk for hazardous substance misuse, what would then happen is a brief intervention, which is a short 1 to 2 session intervention for those kids engaging in some risky behavior, but not yet at the point of dependence. And we'll talk a little bit more about what a brief intervention entails shortly. And then lastly, you have the referral to treatment, to an outside service provider that can actually provide the type of intense substance use treatment that a student with high levels of use may need, or a student who is using, significantly may need. Those might be the types of treatment that schools are not able to provide. So referring to those who have adequate training in substance use treatment can also be an option. SBIRT has been implemented in a number of schools using school-based health clinics, and then also in schools with no health clinic using school-based health teams that may include a nurse, school social worker, school counselor, etc. And in fact, the whole state of Massachusetts is currently engaged in implementing SBIRT. They passed a law in that state stating that all students in their schools need to be screened for substance use. And so they're implementing the SBIRT process with the school-based health teams, and the data on the SBIRT process implementation is continuing to grow. The second piece that you can engage in would be motivational enhancement therapy. This is what is often used as a part of the brief intervention for SBIRT. So it could either be called motivational enhancement therapy or motivational interviewing. It identifies where the student is in their stage of change or wanting to change their behavior and helps them explore and resolve any ambivalence about wanting to change the behavior. This is a feasible approach that could be implemented by school-based mental health personnel with appropriate training. There are a number of free training resources funded through federal grants available online around motivational interviewing. The third piece is cognitive behavioral therapy. This is a therapeutic approach that allows clients to identify and change the relationships between their thoughts, feelings, and actions. And many school-based mental health personnel should be familiar with CBT already, but if this was something that was going to be implemented, it should definitely be supported with additional training. And the last piece is contingency management. This is exactly what it sounds like. So if you do positive behavior interventions and supports, then you are already doing something similar already. It's just a way to provide reinforcement for students who engage in therapy or remain drug-free. These are all sort of gold star evidence-based approaches supported by SAMHSA that can be implemented. Hopefully some more feasible ways that maybe school-based mental health personnel can incorporate some of these skills into what they're already doing in order to help kids who are already disclosing their drug use to them. When it comes to actually manualized programs, there are a number of manualized evidence-based programs that you can kind of just pull off the shelf and implement that address adolescent substance use at all three tiers of intervention. So the Michigan Model for Health is and the Too Good for Drugs and Violence, that's for ages 6 to 17. Both of those are universal prevention interventions that address alcohol and drug use, and then numerous other behaviors such as aggression or violence-related behavior. These would be things that you potentially would have teachers implement at the classroom level. You also have building assets and reducing risk. That could be used as a Tier 1 or a Tier 2 small group type intervention that focuses on social competencies and the prevention of substance use. For Tier 2 and 3, you've got the Ripple Effects Whole Spectrum Intervention System for ages 6 to 17, focuses on education, mental health, social functioning, substance use prevention, and then there's a manualized version of the motivational enhancement therapy and cognitive behavioral therapy. Oftentimes, those may be combined together into one program for ages 13 to 17. Substance use, emotional problems, and illegal activities, really generally risky behaviors is what MET and CBT will focus on. And then lastly, you have the 7 challenges. This is the most intense. I've seen school districts implement this in a number of places. This is for ages 13 to 17. One example, I have a school district, Memphis, that uses this potentially as a diversion. So if students are identified as having substance use issues, they have a substance use prevention team at the district level that will then implement the 7 challenges intervention with those students. And this is for substance use and related problems and also symptoms of mental health problems. So depending on where you want to start your intervention and prevention efforts, there are a number of programs that can be implemented at the various tiers that are present within your school building or school district. Now, what do we do about service provision during COVID-19? Well, COVID-19 has definitely changed what school mental health service provision looks like. Historically, schools have served as the main service provider of mental health services for kids. In fact, about 70% of kids who receive their mental health services actually receive them in schools. So again, not forgetting that this pandemic can also contribute to trauma for kids. So another resource is to think about cognitive behavioral intervention for trauma in schools, or CBIT. That's another resource for working with kids and families that is evidence-based that can be implemented to address not that can be implemented to address mental health issues that you may see arise from this COVID pandemic. Another way that you can address service provision during COVID-19 is to facilitate technology-enabled modalities that either expand or extend your face-to-face encounters. For example, the state of Kentucky has actually changed its regulations to make it easier for schools to provide telehealth services to their students. So check your state regulations, check with your state Department of Education, and identify whether or not you can expand or extend your services to be able to provide telehealth to those kids who need it. These services can also be provided in individual or group settings and are similarly effective as face-to-face interventions. Schools can also coordinate their services with local community mental health service providers. So I know a number of schools that I've partnered with already partner with community mental health service providers. Sometimes those providers come into the schools to provide the mental health services. If you already have a partnership with community service providers, it's a really good time to get together and brainstorm on how to ensure students can continue to receive their services. If you don't already have a partnership with community service providers, now might be a good time to identify ways that your district can partner with agencies in your district, and also continue to have conversations around what services will look like, what type of PPE is necessary for face-to-face sessions, all of these conversations. I think making sure that the students are still getting the services that they need, regardless of any barriers that might be there, is really important, because right now is a time where students are actually needing services the most. And so if we can find a way for our school counselors and social workers and psychologists to be able to reach out to students that are in their schools, for them to be able to have virtual office hours, for students to be able to sign up for ways to meet one-on-one with the counselors. Students sometimes like to have agency in identifying services, just like students walk into counseling offices and ask for services. I think we need to make sure that students still have a way to be able to do that, and that it's advertised a lot more than maybe in the past. And then lastly, the Substance Abuse and Mental Health Services Administration has a treatment locator. So if you're interested in figuring out, well, where would I even refer these kids if they are identified as having substance use issues, or if they do disclose and they do need treatment, go on to this SAMHSA website and you can put in your zip code and you can identify what treatment facilities are nearby and local to you.
Thanks, Dr. Fisher. That was some fantastic information on school-based strategies. Before we continue to our next section, I actually wanted to pause and pose a few questions that came in as you were speaking. So one question that we received from the field is dabbing a synthetic cannabinoid.
Is dabbing
this
a
question
synthetic? I'm actually not sure. I don't think I've ever heard that term before.
No problem. And then another question that came in from the field is 5 or more in a row is an indicator for adults as well.
Yes. Yep, 5 or more in a row. And it actually depends. It also changes based on your gender. So we say 5 or more in a row, but actually when it comes to women, they drop it to 3 or more in a row. So it depends on, I think if you get into the details of what binge drinking actually is, instead of making a general statement, there are actually statements that can be made based on gender and sometimes based on age, but that was what they used as a part of the Monitoring the Future survey. Yeah.
Fantastic. And then is there training available for teachers and school counselors on this topic?
That's a good question. I'm not sure. I think most of the training that I've seen happen on this topic have come from state departments. Many states have behavioral health departments that may put on trainings for teachers and school counselors or social workers. I also know if you go to the school mental health, there's a school mental health agency, there may be some trainings there. But I mean, substance use in schools, unfortunately, and providing prevention and training in this area is something that we're really trying to increase access to. And that's definitely something that I'm working with local districts to provide training in. So I would definitely suggest that you check your state agency on behavioral health, and then also check some of your professional organizations, some of their CEUs and trainings. They also may provide some there, particularly for the school counselors.
Thank you so much for providing that information, and thank you for your questions that have been coming in. We appreciate those. Feel free to continue to send questions as they come to you during this presentation. And we will now pivot and talk about how schools with their school safety teams can plan for opioid overdoses and other drug-related emergencies. So before we dive in, we have another poll question for you. I'd like to get a sense of where you and your school are with emergency operations planning for opioids and substance use. Does your education agency have an opioid overdose or drug use annex in your emergency operations plan? And also, we're wondering if it's been updated in the past year. Maybe you have one, but you need to update it. Maybe your school does not have an annex, but you do address the topic in another annex. Perhaps you do not have one yet, but you plan to create one in the future, and there might be some other instances as well. Looking at the results coming in, we have quite a variety of different states of annexes. 45% are reporting another situation, and 10 to 17% are in the different levels of yes, they have them, or no, they do not, for different reasons. But this is great information. Thank you so much for sharing. We would like, whether you would like to create one or you have plans to revise your own annex that's already existing in your plan, we do have resources to support you. And we will be sharing some federal guidance now on how you can accomplish this important work. Thanks again for responding to your poll question. We will now end the poll. So the information that we provide today in the context of addressing an opioid overdose are based on recommendations for developing a high-quality emergency operations plan that can be found in the Guide for Developing High-Quality School Emergency Operations Plan, which we will also call the School Guide. And that was developed in partnership with 6 federal agencies with roles and responsibilities in emergency preparedness, including the U.S. Department of Education, the U.S. Department of Justice, led by the Federal Bureau of Investigation, the U.S. Department of Homeland Security, led by the Federal Emergency Management Agency, and the U.S. Department of Health and Human Services. The school guide includes planning considerations such as the 5 mission areas and before, during, and after timeframes of an incident, as well as a recommended 6-step planning process that is critical and ongoing to help schools create, review, or revise a high-quality emergency operations plan or a component of one. The 6-step planning process was also included in the role of districts in developing high-quality school emergency operations plans, also known as the District Guide, which was released just last year in 2019. The district guide serves as a companion to the school guide and provides information that can assist school districts in fulfilling both their individual and shared emergency planning responsibilities in all hazard school EOP development. We have an archived webinar on our site that discusses this district guide in further detail, and both of these guides are available in our web links pod. We will now explore the 6-step planning process and how planning teams can address opioid overdose emergencies in this context. In step 1, schools form a collaborative planning team. The core planning team will likely comprise of school and school district personnel, students or family representatives, and community partners such as public health practitioners and emergency medical services personnel. Having representation from public health will help bring individuals to the team who are aware of the community-wide nature of the issue of opioid misuse and abuse. School nurses and EMS representatives may also have direct expertise in treating an opioid overdose. These team members will help bring critical knowledge to subsequent aspects of plan development and implementation, and to ensuring that the plan adequately and comprehensively addresses a potential opioid overdose event. In step 2, school planning teams seek to understand the situation by identifying threats and hazards to the whole school community and their prevalence. This is completed using a variety of formal and informal assessment tools, evaluating those risks, and prioritizing them for inclusion in the EOP. Public health personnel will be able to contribute knowledge and data on opioid use and abuse rates within the community to help understand the severity of the problem and the degree to which it needs to be prioritized within the list of threats and hazards created in step 2. Schools may have data as well to inform this. Many schools and school districts administer annual or biannual student surveys that include questions on drug use, which can yield data to help inform an understanding of the prevalence of use at a site. For example, the Youth Risk Behavior Surveillance System, YRBS. Planning teams can also consult with student government or other student organizations to better understand the extent of the problem and how to address it. Other issues that may arise in an educational community due to a culture of prevalent drug use, such as fighting, property crimes, and weapons on campus, and their effects on student and staff perceptions of safety can be measured through culture and climate assessments. The U.S. Department of Education provides several school climate surveys, which measure 3 domains of engagement: safety, including drug use in general, and the environment. And Elise will talk a bit more about this resource later. After assessing the level of risk posed by threats and hazards, the planning team in step 3 addresses goals and objectives to achieve the best outcome for before, during, and after an incident. For example, when developing goals for addressing an opioid overdose, 3 of them may be as follows. Before, the goal could be prevent an opioid overdose from occurring. A during goal could be respond to an opioid overdose. And an after goal could be to offer recovery support to individuals who overdosed on an opioid. And using the goal of preventing an opioid overdose from occurring as an example, possible objectives for schools could include fostering a positive campus climate, educating parents and guardians on the potential for children to misuse opioids and how to properly store and dispose of their prescription drugs to help prevent youth from accessing them. And lastly, another objective could be to safely store student prescription medications on campus. In step 4, the planning team identifies courses of action for accomplishing each of the previously identified objectives to address the what, who, when, where, why, and how. For example, a planning team may address the objective safely store student prescription medications on campus by determining how policies and procedures will be developed to store prescription medications throughout the school day and during school breaks. Also, planning teams would need to consider how to safely dispose of student prescription medications, whether they are in liquid or in pill form. And using scenario-based planning can help planning teams imagine the different ways that an opioid overdose may unfold and the steps your education agency and community partners should take. You will most likely need to add references to any functional annexes that are applicable to an opioid overdose. For example, you could add a note for when an opioid overdose has occurred to see the public health, medical, and mental health annex on where naloxone is located and who is responsible for purchasing and maintaining such supplies. Other functional annexes that relate to drug-related emergencies may include the Alert, Communications, and Warning Annex and the Recovery Annex. In step 5, the planning team now formats the material of the plan into a draft emergency operations plan. And using the traditional EOP format, an opioid overdose annex would be in the threat or hazard-specific annexes of the EOP, which we briefly mentioned earlier today. Once the draft plan is prepared, the planning team reviews the plan for both plan content and writing conventions, revises the plan accordingly, obtains official approval of the plan from leadership, and shares the plan with community partners. You can consider sharing the opioid overdose annex with community partners who have a responsibility in opioids, such as first responders and local public health officials. Finally, in step 6, the emergency operations plan is maintained via regular reviews and revised when needed. Further, individuals with roles outlined in the emergency operations plan are trained in their responsibilities, and exercises are conducted to test the ability of the school to continually prevent, protect, mitigate the effects of, respond to, and recover from an incident while protecting the school community from a wide variety of threats or hazards. As a threat such as opioid, drug, or substance use changes by the population most affected, or perhaps the types of drugs most prevalent, planning teams may need to update their plans accordingly. Consider conducting exercises that practice the annex and posting key information on drugs and opioids throughout the building. And whenever possible, make sure to conduct a debriefing after the drill or exercise to identify gaps and to address those areas of improvement during plan revisions. Thinking about the current context that we face today, how will your school ensure that the annex is exercised during the COVID-19 pandemic? And what considerations does that present, and how will training be executed? So now that we have discussed how schools can plan for drug-related emergencies and opioid overdose, and the 6-step planning process that can be used to accomplish this important work, I will hand things over to Elise to take us through some resources that can help prevent and reduce drug and substance abuse. Elise?
Great. Thank you so much, Allison, and thank you everyone for joining us today. Again, my name is Elise Robertson, and as Allison stated earlier, I work at the U.S. Department of Education in our Office of Safe and Supportive Schools. And the Department of Education, we have a long history of supporting drug prevention programs and providing resources and support. And over the next few slides, I'll be highlighting just some relevant resources that are free and publicly available for you to consider using to help as you are developing your drug prevention programs, or maybe improving programs already in place, all in order to help prevent and reduce youth substance use in your local spheres of influence. So we all know that schools and their environments are connected to student success. Students learn best when they are in environments in which they feel safe, challenged, and accepted. Strong school climates foster the social, emotional, and academic well-being of all students. Now, while the causes of substance misuse are complex and determined by multiple factors, some of which Dr. Fisher mentioned earlier, the outcome of a positive school climate is to reduce risk factors and increase protective factors that will ultimately increase resiliency for children and youth. Now, in order to improve school climate, we need to be able to measure school climate using high-quality, reliable data that will allow for us to more easily monitor progress, make data-driven decisions, involve the right partners when needed, and also to adapt to shifting needs when needed and when they arise. To help in this effort, I want to highlight two resources: the School Climate Improvement Resource Package and the ED School Climate Survey. The School Climate Improvement Resource Package includes a variety of resources, such as an action guide or multiple action guides and online modules with the intent to help meet the wide-ranging needs of stakeholders to improve your school climate. And the ED School Climate Survey is a web-based platform to assist state education agencies, school districts, and schools in collecting and reviewing reliable school climate data in real time. Actually, in fact, one of the 13 measures already embedded in the School Climate Survey is already focused on substance abuse. So hopefully some of the work has already been done for you, but these two resources are available and also are adaptable. So you, depending on your current context in your climate, you're able to add to these resources to collect data that is relevant and useful to your context. Now, since the opioid crisis was declared a public health emergency in 2017, as Allison mentioned earlier, the department has streamlined our efforts to help stakeholders learn more about the opioid crisis and access targeted resources to help prevent and reduce youth substance use. The department does have a dedicated webpage with resources that are separated into groupings for ease in viewing and retrieving, such as resources for youth, resources for schools and teachers, resources for parents and caregivers, etc. And the resources on the website are not just from the Department of Education, but from other federal partners that really focus and provide drug education-related information for, again, our groupings for youth, parents and caregivers, and schools and school personnel. And for example, we have resources hyperlinked from the National Institute of Drug Abuse, the Substance Abuse and Mental Health Services Administration, and the Drug Enforcement Agency. Now, the department has many technical assistance centers, which all have a variety of resources available to help support efforts related to enhancing academic and social behavior outcomes for students. Now, the centers listed on the slide are just a handful of technical assistance support that the department has, but I selected these centers for this webinar today because they have resources specific to drug prevention and supporting students' health and safety. The Readiness and Emergency Management for Schools TA Center, which is, of course, helping us with the webinar today, really helps education agencies and their community partners manage safety, security, and emergency management programs. The Title IV Part A Technical Assistance Center
They help provide support to our state coordinators that implement the Title IV Part A grant program, but they also develop high-quality resources that are aligned with the 3 priority content areas of that grant program, which are well-rounded education, improving the safety and health of students, and effectively using technology. The National Center on Safe Supporting Learning Environments offers information and technical assistance on improving school climate and supports other conditions for learning to improve student outcomes. The Center to Improve Social and Emotional Learning and School Safety is actually one of our newest centers, and they are growing their resource portfolio to target the academic, social, and emotional needs of students. The Positive Behavioral Interventions and Support Center, also known as PBIS, supports schools, districts, and states in building systems of capacity for implementing a multi-tiered approach to social, emotional, and behavioral support. And then lastly, the Youth for Youth Technical Assistance Center supports staff members primarily from the 21st Century Community Learning Centers program, but they also have resources available to help support high-quality after-school programs and improve students' health and well-being. If you have not already, I have provided the hyperlinks to these TA centers' websites on the slide. Please feel free to peruse their resources after today's webinar. And then also, each of the centers should have a listserv, which would be a great way, if you're not already connected, to learning more about different training opportunities that become available, as well as staying up to date on new resources as they come out. So last year, the department developed a 3-part webinar series that looked at how the opioid crisis was affecting students and families and provided strategies to help schools and school districts address the crisis along with other substance-related issues. 2 of the webinars focused specifically on K-12 education systems, and 1 webinar focused on institutes of higher education. To access the archived webinars, please follow the hyperlinks provided on the slide, as well as their supplemental resources and information that went with those webinars. So the Institute of Education Sciences, or IES, releases the Condition of Education and Indicators of School Crime and Safety reports annually. And both of these reports have indicators and data related to school safety. The information included in these reports really highlights important trends at both the K-12 education and post-secondary education levels. And what I find interesting in these reports are the information and data on the availability, the student use, and perceived harmfulness of drugs and alcohol in schools, as well as in nearby communities. So if you've not had a chance to look at the newest reports this year, we've provided hyperlinks on the side for you to review them. And additionally, IES, again, the Institute of Education Sciences, they fund the National Center for Rural School Mental Health. And this center has been supporting partnerships with rural school districts in a few states to develop and test ways to support the mental health needs of their students. And in response to the COVID-19 crisis in particular, the center has compiled a set of resources targeted for families, schools, teachers, and youth on a wide range of pandemic-related challenges, including supporting children who are living in environments where drugs and other substances are present. To access the webpage, I provided a link on the slide. I believe it's in the web bank as well. But of course, since the resources are targeted for rural communities, that doesn't mean that urban or suburban communities wouldn't also benefit from the information being provided. And then lastly, the department continues to work collaboratively with other federal agencies to develop resources to support the needs of our stakeholders. One of such resources is the Growing Up Drug-Free, A Parent's Guide to Prevention. And this was a publication developed in partnership with the Drug Enforcement Agency, or DEA. And it's actually an award-winning publication that offers information to help parents and other caregivers raise drug-free children. And the second resource that we wanted to share is the Substance Use Prevention and Resource Guide for School Staff. And this was created through a collaborative efforts with the Office of National Drug Control Policy with many other federal partners. And the guide was developed to support teachers, administrators, and other school staff to help educate and protect students from substance abuse. Again, to access these two resources, we provided hyperlinks on the slide, but also they should be in the web bank as well. That's all I have. Thank you for giving me the opportunity to speak. And I'll now turn the controls back over to Allison.
Thanks, Elise. As Elise mentioned, the REMS Center also has some resources to support you in your planning efforts. And one of those resources is a fact sheet that we wrote and researched on opioids, and that is available to download from your web links pod. This is a great resource for you to share with your colleagues on this topic and include some of the information we discussed today. Just to provide a quick overview of that, it introduces you to the topic of opioids, provides some information on planning for opioid emergencies, and then follows up with some opioid-related preparedness activities, framing it around those preparedness mission areas: prevention, protection, mitigation, response, and recovery, and then provides some additional resources and sample materials. We also have many other resources on our website. One of those is a topic-specific resources section, and that's a section of our website that's dedicated to housing resources from the REMS TA Center, from the U.S. Department of Education and federal partners on 20 topics within the area of school safety, security, emergency management, and preparedness. And that includes resources on human caused threats, as is discussed today, as well as public health and many others. The REMS TA Center has created other resources to support schools and school districts in emergency management planning directly, including an archived webinar on the district guide that I mentioned earlier, an at-a-glance version of the school guide, online courses on developing high-quality emergency operations plans. We have a software application on developing plans, training packages dedicated to this important topic, and much, much more. We have created some training resources on resilience strategies for educators, which is an excellent topic, and that's available in formats such as an archived webinar, training by request, and a downloadable training package. And furthermore, there are many resources created by partners in the field in addition to what has already been shared. And to name a few, the National Association of School Nurses has an naloxone in schools toolkit, and then the Substance Abuse and Mental Health Services Administration has an opioid overdose prevention toolkit, and both of those are accessible in your web links pod. And so now it is time for our question and answer session. We will begin by answering questions that you've already submitted to us, but we encourage you to continue to send us your questions as they come to you during the session by using the Q&A pod on your screen. Questions will be answered in the order in which they appear and as time permits. So one question that we received is, have you seen any, and this question is for Dr. Fisher, have you seen any correlation with substance use and gambling in youth? Our local substance abuse center mentioned this to me and discussed how they are seeing gambling as a new, quote, gateway.
Hi, yes. So definitely a correlation between gambling and other addictions. So addiction, the risk for engaging in addictive behaviors is typically the same risk profile. And so that addictive behavior may come out in a number of different ways. So you may end up presenting that addictive behavior either through gambling or through substance use, maybe through video game use or eating or a number of different ways. So there are definitely correlations between the various types of addictive behaviors, including gambling and substance use.
Thank you, Dr. Fisher.
Mm-hmm.
This next question is for Elise in the department. What can I share with students?
Okay, great. Thank you, Allison. So what can you share with students? So the Department of Education, as I mentioned before, we do have a web page that does have a grouping specifically for youth. And within that web page are youth-focused resources that's been pulled together that can be shared with youth. Additionally, I'm aware that the National Institute on Drug Abuse, they do have a teen-specific website that has information resources that are curated specifically for youth and youth learning more about, the dangers around substance use and misuse, as well as I know the DEA, the Drug Enforcement Agency, they do have a few websites that also have, resources and information that are youth geared and focused. They can be accessed on their Operation Prevention website, as well as I believe they have another website called Get Smart About Drugs. Yes.
Fantastic. Thank you, Elise, for sharing those resources with everyone. The next question is for the REMS TA Center. And the question is, this is great information. Will you be sharing the slides? And the answer is yes, we will. All of our webinars are archived for later viewing, including the download of the PDF of the slides that you see here today. So within 7 business days, there'll be a new web page on our site dedicated to this webinar, and you'll be able to share that with your peers. They'll be able to listen and listen to this webinar just as you have today, as well as download and take a look at the slides that we used during today's presentation. This next question is for Dr. Fisher, and the question is, have you seen any recent studies that measure the rates of substance use disorder in ACEs?
Hello. So really good question. I am not too familiar with this literature, but I do know that there is, as far as the rate of substance use disorders, I'm not sure, but I do know that a 2018 study found that if you have high ACEs or multiple ACEs, you're more likely to have more alcohol-related problems, current tobacco use, and psychological symptoms. So again, I think because the ACEs, the profiles of the ACEs can be so different because of the questions that are asked, I'm not particularly sure about the rate that would occur based on those answers, but low ACEs corresponded to less risk for substance use, and then multiple ACEs or high ACEs were found to be associated with higher rates of alcohol-related problems and tobacco use. But that's definitely a good question, and we'll be interested in learning a little bit more about that.
Thank you, Dr. Fisher. This next question is for all of the presenters. Can we extend what we learn in this session to adults, and particularly the homeless population, as the substance use epidemic is rampant?
This is Elise. I'll start. Yes, certainly. I think all of the information and strategies shared also can extend to our youth experiencing homelessness population as well as young adults. I do know, and I'm certain this this person that asked this question is already aware, but the department does have a technical assistance center that is they are devoted to supporting youth experiencing homelessness as well as ensuring their educational continuity. And they're called the National Center, I believe it's NCHE is their acronym, National Center for Homeless Education. I'm just confirming that right now. National Center for Homeless Education, yes. And I know that they have a wealth of resources as well, and also some that are specific to supporting youth experiencing homelessness who are also, experiencing substance-related issues.
Dr. Fisher, I would say I have a colleague of mine who does research on providing substance use treatment options for the adult homeless population. And the biggest thing that he's shared with me is just trying to work with and through community caseworkers to be able to provide access to treatment. So some of the work that he's working on right now is thinking about how do you use these community caseworkers to be able to provide telehealth and get them access to naloxone and that sort of thing. And so definitely trying to go to where the homeless population has connections in the community, and then connecting with those folks is a way that he's been finding he's able to do his work there, and then also through the VA.
Thank you, Elise and Dr. Fisher. And just one more thing to note, the REMS TA Center recently hosted a webinar last month on the topic of supports for homeless students during the COVID-19 pandemic that is already archived on our site for viewing. And so we encourage you to check that resource out. We hosted that webinar with the National Center for Homeless Education, which is one of the department's TA centers, as Elise mentioned, along with Schoolhouse Connection. The next question is for Dr. Fisher. Are there any ways to support our Indigenous youth?
Yeah, so this question, I think there are a lot of ways to approach it. I would definitely say Indigenous youth have unique needs when it comes to substance misuse. They typically have higher rates of substance misuse because of a number of different factors. And for me, I think that the first step would be to partner with the community or a cultural broker to share your services or make referrals. It's really difficult to provide services to Indigenous youth coming from an outsider's perspective or stance. And so there has to be a lot of community building and trust building that happens first before any acceptance of supports will be accepted. So I think that's the very first step. I will say that research on, culturally relevant approaches for Indigenous populations is growing. I have colleagues that are doing culturally adapted interventions for this population now, but I will definitely say that there's limited work on showing what works effectively, and we definitely need to increase our research in this area.
Thank you, Dr. Fisher. Another question that is also, again, for Dr. Fisher is, what can we do when we can't meet people face-to-face and offer that help?
So I think one thing that has been, I think, helpful for the other educational pieces of this is to really try to use these teleconference platforms that can be made to be HIPAA compliant. Or schools may want to invest in a specific platform for mental health service providers, thinking about the provision of these services either in a synchronous or asynchronous way for students, maybe even doing asynchronous modules for general prevention that you think perhaps 80% of your students might respond to, and doing more synchronous, intense small group or individual meetings through the teleconference platforms for those who need a bit more support. I think the biggest thing is to be able to try to find a way to reach out to students and for students to be able to sign up for support, whether it's creating, you know, a locked Google Doc where students can sign up for times or office hours with the school social worker or school counselor, sending out a survey to all the students where they can indicate if they need to be followed up with. It's really important for us to do the reaching out and then follow up with those kids who have identified needing additional support.
Thank you, Dr. Fisher. So the next question is for the REMS TA Center. How can universities best keep college students safe? And I understand that we focus on K-12 today, but the six-step planning process that we discussed could also be used by institutions of higher education. In fact, this process is featured in the Guide for Developing High-Quality Emergency Operations Plans for Institutions of Higher Education, which was also released in 2013 at the same time as the school guide with the same authors. And to supplement your work in higher education safety, the REMS TA Center has created many tools and resources on safety, security, emergency management, and preparedness for both two-year and four-year institutions. And just to name a few of those, we have a web-based app called EOP Assess, and it helps get planning teams familiar with the process and principles and important terminology so that they're all on the same page as they engage in that planning process. We also have another web-based app called EOP Evaluate that helps teams evaluate their existing plans against recommendations based in the higher ed guide. And then we have a free mobile application that's available for both Apple and Android mobile devices that they can use to conduct a site assessment of their school or campus grounds and buildings. So that's examining the safety, security, accessibility, and emergency management of the physical environment on campus. Is there anything else that?
Yeah, this is Elise. I'm going to jump in for this question too. So, I mean, all of the resources that you just shared, I thank it. But also, I just want to reiterate one of the third of the three-part webinar series that the department, hosted last year. That third webinar was hosted in partnership with the Office of National Drug Control Policy, and that webinar specifically addressed how institutes of higher education are providing support to students who are recovering from opioid or alcohol or other substance related issues through collegiate recovery programs and other similar initiatives. So certainly, if my memory serves me correct, there were 3 collegiate recovery programs highlighted in that webinar. So that would be certainly a source of information to kind of continue in the collegiate space for keeping students safe. And I believe the DEA has a website as well, specifically to support college students and also universities in creating drug-free environments. And I believe the title of that website is Campus Drug Prevention.
Thanks, Elise, for sharing that. Our next question is for Dr. Fisher. How can schools support students and families dealing with opioid abuse?
I think the best way is to be a conduit to additional services, to be able to disseminate information about community resources and make them readily available. Can also include information in parent newsletters or emails that are sent out. And then if you have a student that discloses to you about having a family member dealing with an opioid abuse, and sort of treading lightly to be able to refer that family to additional services if they accept them.
Thank you very much. Our next question is also for Dr. Fisher. What strategies are there to help prevent substance abuse in students?
So there are a number of risk and protective factors that contribute to substance abuse in students, and it's a combination of genetic and environmental influences, but schools can make sure that they have, like Elise said, a welcoming and positive school climate, and that reduces the risk factors for substance misuse, reducing things like bullying and peer victimization that are associated with substance use, making sure that students have a trusted, caring adult in the building that they feel supports them, check on and provide services to students who are at risk. So in my section of the presentation, I sort of talked about those kids who have elevated levels of externalizing behaviors, those kids who might have 504 plans or IEPs for ADHD or emotional behavioral disorders, those who are failing classes or have attendance and behavioral concerns, perhaps connecting them with a caring adult in the building. Something like the evidence-based intervention check-in, check-out might be helpful for them to make them connect to the school environment again. And then make sure that they have a positive activity to engage in. Clubs, sports, teams, trying to take care of some of that out-of-school time for those students will also help reduce the risk for substance abuse in students.
Awesome information. And one last question for Dr. Fisher. How are schools engaging with youth and students to support prevention efforts? Specifically, this requester is interested in hearing if youth are serving in leadership roles to help problem solve in this space.
Yeah, so, there are a number of programs and evidence-based programs that sort of have a peer leadership component to them. There is emerging evidence that it's promising, but the evidence based on their effectiveness is limited. So larger trials are needed, larger studies are needed to show whether or not engaging peers in the intervention process is helpful. But I do think that it's a great idea to be able to bring students in to problem solve with them around how to tackle this problem. So setting up school committees or communities, kids know how other kids are using, and they know ways that will be effective for intervening. In fact, many intervention programs start with these focus groups with adolescents to try to identify ways that will be the best to implement programs. So doing that at the school level, I think would be a great idea to get some ideas of the best ways to help.
Thanks, Dr. Fisher. And as we wrap up our Q&A session, I do have one last question for Elise. Do you have more information about drug treatment for adolescents?
Thanks, Allison. So just more information for drug treatment globally, I would say no. However, I do think what Dr. Fisher stated earlier is how the SAMHSA, or the Substance Abuse Mental Health Services Administration, does have a very easy, interactive website called findtreatment.gov. And this website not only has information on how to locate local substance use treatment facilities and state licensed providers in your area just by using a zip code, but the website also has some unique features using like a filter option that allows for users to even more so other than just by zip code, target search functions to help locate specific treatment support that are, unique and specific to each, individual person. And there's filters that, you can access certain types of treatment, payment options, even there's an age function, which is my personal favorite, specifically when we're talking about youth, on finding local treatment facilities that can support youth who are under 18 as well as over 18. And there's other features as well. So I would just think it's what Dr. Fisher mentioned earlier in our presentation on going to SAMHSA's findtreatment.gov website.
Thanks, Elise, and thanks to both of our presenters for some great information presented during this Q&A session. And thanks to all of our participants for submitting your questions today. If you did send us a question and we did not get to it, or if you just thought of a new question, feel free to email us at info@remscacenter.org. And we may be getting to some of those questions during our 30-minute Twitter chat that will be starting in a few minutes. So you can participate by using hashtag #chatwithrems and tagging us at REMS TA Center, and we look forward to seeing you on Twitter right now. Thank you all for joining us today, and please remember that you can connect to your National School Safety Center in a variety of ways, including our toll-free phone line and info@remstacenter.org. And be sure to find us on Twitter for daily updates on REMS TA Center activities and important information and services from our collaborative partners. Thank you again for your time today, and this concludes the webinar. See you on Twitter.